speaker tonight, our guest tonight is Dr. Stephen Barrett. And as you can see, which you can't read because it's way too small, he has a rather impressive resume. He's an American retired psychiatrist, author, co-founder of the National Council Against Health Fraud, and the webmaster of Quackwatch. He runs a number of websites dealing with quackery and health fraud. He focuses on consumer protection, medical ethics, and scientific skepticism. And as I said, you can see he has a rather impressive background, and that doesn't include a great deal of his accomplishments. We're very pleased to have you with us, Dr. Barrett, and I am going to turn the screen over to you. There you go.
Okay.
All right.
And I'm old enough to have watched while scientific medicine went from only being able to treat a few conditions to having a phenomenal understanding and success in managing and treating all sorts of diseases. But along with that, people who have screwball ideas or who want to cheat people have also developed their ability. They've developed their persuasive ability, and they've developed their communication skills. And there's also arisen a network of many networks, many different ways that people can interact with each other, so that somebody can have an idea, it can spread to millions of people within minutes. So what's happened is that on the scientific side, things have gotten better. On the quack side, it's hard to say. Some things have gotten worse. It's possible now for people like me to get our message out much more easily than it was years ago. On the other hand, there are now millions of people who are competing for public attention. Now I'm going to share the screen. Hopefully, here we go, share.
We had technical difficulties. I apologize. We will begin in the middle of the slideshow.
Fraud should be reserved for deliberate deception. Malpractice is the failure to meet accepted standards. In other words, if there are certain standards and you don't live up to them, that's malpractice. I mention this because people say, why don't you count what doctors do wrong? Well, the answer is, if it's malpractice, if it doesn't involve something pseudoscientific, it's not quackery, but sometimes quackery does involve malpractice and fraud in addition to pseudoscience. Now, most people don't realize how much quackery can harm. The harm that's the greatest in terms of the number of people affected is bogus products and services. It's economic. Whoops. I clicked the wrong place, just 1 second. There's direct physical harm. Sometimes if you take a quack product, you can die. It doesn't happen often because basically people who sell quack things really don't want to kill their customers. They want them to keep coming back. Then there's indirect harm, which is fairly common. And that's failing to get appropriate care, failing to get effective care. You'll be harmed by simply not getting what you need. Another indirect harm would be loss of time. Another indirect harm is damage to relationships. I've seen many families where, let's say a parent wants to do a certain thing for a child, and the other parent thinks it's nuts. And I've seen marriages fall apart over that. It's a pretty serious thing because many times the people actually love each other, but they're incompatible because of of their belief systems. Then there's psychological harm. Psychological harm is extremely common. If you take a product that basically does nothing and you feel better and you decide that it was the product that helped you, you've been psychologically damaged, and that will make you more vulnerable. And I think you've all seen examples of psychological harm among your friends where they have a belief, think it helps them, and you know that it didn't, but they can't believe that. Then there's the harm to society. The harm to society is economic. Billions of dollars are wasted. Where does the money go? In some cases, it goes into the pockets of politicians. In some cases, it goes into the pockets of crooks who do lots of harm. It may affect harm through taxpayers, et cetera. So the economic harm, there are billions wasted on products and services that are useless, unnecessary, or ineffective. There are dietary supplements, herbal products, homeopathic products, pseudoscientific care, magnets, other gadgets, educational products. The list is pretty long. One of my friends observed something that has really stuck with me. Quacks never sleep. When we sent a rocket to the moon, how long do you think it took before moon dust was being sold? Only a few weeks. This one is funny. This was a sale of Florsheim shoes with magnets in the soles. And Florsheim used to make a terrific shoe. I haven't followed them lately. My Florsheim shoes are a little heavy, but they're still good after 50 years. Anyway, and one of the things they said is that some people suffer from magnetic deficiency because the Earth has lost some of its electromagnetic field. And I thought that was very funny. I wondered, for example, if you had a magnetic deficiency and you put these shoes on, what if you wore them too long? Would you have a magnetic excess? Oh, just a second. Anyway, I complained, I forget where, and they disappeared. I guess somebody filed a lawsuit as well, and they disappeared from the marketplace pretty well. Direct physical harm is pretty straightforward. Occasionally bad manufacturing, which is associated with supplements, or ingredients in the supplements and herbs themselves can cause harm. Not terribly common, again, because you don't want to be hurting your customers. But people who take herbal cleanses often suffer from diarrhea because these cleanses, which are said to clean your liver, which they don't, can cause diarrhea. Colonics, where you put an enormous amount of water in, supposedly flush out your bowel. Occasionally, the people who do them perforate the colon. That's pretty harmful. You can get stroke from chiropractic neck manipulation. Not very common, but it does happen. And there are some irrational dental procedures that can cause harm. One in which the dentist imagines you have cavities and scrapes out your jaw, which may result in loss of the jaw. Pretty serious stuff. Here's a case of extraordinarily serious harm. Whoops. This is a woman who went to a naturopath who was blind. He felt her nose and felt a little bump on it and said, "Oh my goodness, that's a cancer." And this is not a stupid woman. I talked to her and she's really not at all stupid. But what happened was she had tremendous trust in the chiropractor in whose office the naturopath worked. And the trust carried over to this man, and she really didn't have any idea what she was getting into. She got a black salve Yeah. A little salve and put a little bit on her nose, began to burn. She called him up and he said, "Oh, it's working. Put more on." And she kept putting more on until she realized that she was burning the skin off her face. And this shows the area that was at surgery. It shows the area that had to be cleaned up in order to put grafts on. She recovered her face. They rebuilt her nose. She doesn't look great, but at least she has a face. The doctor involved lost his license. I'm sorry, no, I'm thinking of somebody else. No, the naturopath was not prosecuted by the state. It kind of fell through the cracks. Okay, so indirect harm occurs seriously when people have cancer and they go to somebody who says, if you do this or that, it's going to fix you, and you don't want to take chemotherapy. It's very toxic. There's loss of harm. Sometimes people only have a few months to live, loss of time rather. People have a few months to live, and instead of being able to settle their affairs, they waste their time pursuing something that doesn't exist. Damage to relationships is another thing that's can be pretty serious. I've seen it with autistic children, the parents of autistic children. I've seen it in families where one person goes to get a treatment. I had one man call me and said, my wife is in the hands of a quack who's telling her she's got a certain condition. And my wife has already spent $80,000. And I hesitate to speak up because I think she'll divorce me. And I said, you better protect yourself, because if you don't, what's going to happen is they'll get all your money and then you'll get divorced. So she spoke up and they got divorced. It took about 10 years. They kind of reconciled, at least they're friendly, but at least the financial hemorrhage was stopped. This is an example of how cancer quacks scare people. This is from a comic book many years ago. And they talk about cutting, burning, and poisoning. And for some people, it's effective. And just to show you that this is not new, this is from about 100 years ago. And says pretty much the same thing. And you're not going to have a knife or pain. I guarantee it, et cetera, et cetera, et cetera. And that's how it looked more than 100 years ago. People, it's not difficult to find people who will swear that whatever they did cured them of cancer. Of course, the patient may not have had cancer. The patient may have had standard treatment and cured or put in remission, but the quacks claim credit for the result. And that's very tricky. The vast majority of people who give testimonials fall into this group where they had standard treatment helped them, but they give credit to the wrong place. Sometimes the cancer is slow growing, represented as cured, and it isn't. In many cases, people who give testimonials are already dead. They're represented on the web as cured. Very rarely cancers go away. And I mean, those are great for the quacks, but doesn't help the patient any. This is an example of a testimonial, probably the most powerful one I've ever seen. This woman was an orthopedic surgeon and claimed that she had cancer in her breast. She did have cancer in her breast. She posted the pathology report. She had a biopsy, didn't get it all. She had another biopsy to get the rest of it. And then sometime later, she developed a lump and claims that this lump was cancer. Well, I would bet my life it was not cancer because it grew within a month. It looks like a cyst. She went and had it debulked, that is to say, had the fluid taken out, a little bit trimmed on the edges. Of course, it went away, never came back, and she claims that she cured herself by diet and prayer. And she sells videotapes, made quite a bit of money. Very dangerous, because she tells people not to trust their doctor, and she sounds persuasive. Oops. Psychological harm has to do with false beliefs, shifting of trust, depression if you trust and it doesn't work. Faith healing causes that. You put your trust and it doesn't work, you may blame yourself and get depressed. Harm to society may lead to belief in things that are no good, may lead to scarce research dollars being used to fund them. It may affect election results. People have actually lost elections because of anti-quackery activities. Opposition to public health measures is fairly common, and that's a terrible thing. We see it now with vaccination to COVID-19. We don't know where it's going to wind up, but there are some people who absolutely say they're not going to get vaccinated. And that's, of course, if there are enough of them, it's going to screw up our society really well. Now, with COVID, we've seen, especially on social media, claims that social distancing doesn't work, people saying don't wear a mask, claims that products can boost your immune system. There have been products offered that don't exist. People have been selling masks. You put your order in, you don't get any money. There have been financial scams, all sorts. It's amazing how original people can be. They may want you to invest in a company that has a cure or does other things, invest in research, etc. There have been hundreds of thousands of people victimized. I mean, COVID-19 has only been around for a year and a half. The government has recorded hundreds of thousands of people who've complained of being scammed one way or another. And somebody before I started to talk said, what can we do about people who have certain ideas? I tell them they're stupid. Well, the fact is that it's scary, but there are a tremendous number of people who seem stupid. And unfortunately, telling them that doesn't necessarily help. But it can guide a little bit what you do. Then there's also identity theft. People have been calling with all kinds of COVID-related things. And what they basically want to do is get your Social Security number, your Medicare number, your date of birth, your bank account, anything so they can steal your identity. And most of the time it comes through robocalls, sometimes through emails. Multi-level marketing is a system where people buy distributorships, try to sell products, try to sell other people distributorships. Supposedly, if they buy them, if people buy them and sell products, they get a cut. So what they tell you is you sell distributorships and they'll sell distributorships and down the line. And if you get enough people in your downline, you make a lot of money when there are sales because you'll get a cut. It's just not true. The vast majority of people make no significant money. The vast majority lose money. They never make back their initial investment. Well, maybe if they're lucky, they might make $100 a month, which is not enough for the time they put in. Some of them invest thousands, and some actually have invested hundreds of thousands of dollars, thinking that it will up their commissions and they'll be able to build an organization, et cetera. So there's a potential for serious harm. Not a lot of people. Psychological harm, again, absorbing false beliefs. Social harm can be tremendous. There are people who get so involved in multi-level marketing that they've essentially joined a cult, and their spouse may not like it. There may be family disruption. There may be family economic disruption. There may be family bankruptcy. A political harm, we've seen Donald Trump was involved with two multi-level organizations, but the big one is Amway. One of the Amway people, the starters and descendants of the people who started Amway have become billionaires. One of them has been the biggest funder of the Republican Party. Another one is now the Secretary of Education. All their money was derived from multi-level marketing. Let's talk just a moment about how you can tell what's true, or at least how scientists can tell. Well, you need studies. Studies are needed to separate coincidence from cause and effect. You have to separate. A lot of people get better on their own. So in order to prove a treatment works, you have to compare the treatment with what happens if there's no treatment, the natural course of the ailment. Whoops. And there's a placebo effect. Sometimes you can lose your symptoms because stress is reduced. Most people have had the experience when they have a pain or maybe a toothache, the doctor or the dentist walks into the room, they feel better. And that's a temporary thing, has no effect on the course of disease. And many people think the natural course of the ailment that is getting better on your own is a placebo effect. It's not. Very important to make that distinction. Placebo effects are temporary and they only work on symptoms. So when people say, well, homeopathic remedies are placebos, what do we care as long as it helps you? That's poor reasoning, because what fools people with homeopathic remedies is they would get better on their own. It's not the placebo effect. And then, of course, you need to have your studies set up so that the belief system of the observer doesn't affect the way they score the results. So the study has to be randomized. So you compare people to similar people. It has to be, so you get representative selection, has to be controlled. So you compare people who had the treatment with people who don't, has to be adequately blinded so nobody is fooled by their observations. Now, chiropractic is one of the areas of considerable concern. Chiropractic is based on the theory that spinal bones are displaced and they squeeze the nerves, and that causes.
1 moment.
Huh? Yeah, some people think the nerves go everywhere. Chiropractors will
Still
tell
on
you.
it.
What's that? Okay. Anyway, this is a schematic. Not all chiropractors believe this, but chiropractic theory is based on it. What they say is that these subluxations can be due to all sorts of things: sleeping habits, poor posture, exercise, injuries, auto accidents, sports, slips and falls, the birthing process, and even emotional stress. They claim that manipulation of the spine, which they call adjustments, can fix the subluxations and restore optimal health. Now, this is a chart that shows how misalignments can cause all the conditions here, about 100 of them. And I just, since you can't read it, I just picked out two. This one in the neck can cause certain cases of blindness, deafness, crossed eyes. This one down here can cause appendicitis, cramps, acidosis, and varicose veins. One in the chest kidney troubles, hardening of the arteries, nephritis, and even a kidney infection called pyelitis. The problem with chiropractors is they treat too much. Many of them try to get people into contracts where they see them several times a week or once a month, and that can go on for years. Too many chiropractors oppose immunization. Small percentage of patients whose neck are manipulated get strokes. Chiropractors tend to take too many x-rays. Some of them treat things that are way outside their scope. Most of the ones who give nutrition advice give inappropriate advice. Here's an illustration of why vertebral neck manipulation causes stroke. There's an artery that runs through the vertebra, and when you do a sudden twist, it can tear. Now, homeopathy is based on the idea that if you take a substance, make it very dilute, you can give it to someone who has symptoms of that, and the symptoms will go away. In other words, I didn't say that quite right. If you have someone who has symptoms of a disease, and you can find something that in large amounts will give them those symptoms, giving tiny amounts will cure the condition. And the studies that tested what would cause symptoms were mostly done 100 to 200 years ago, where they knew nothing about the placebo effect. The chiropractors claim that the more something is diluted, the more powerful the effect. In some cases, the dilution is so great that there isn't a single molecule of the active ingredient left. This is one such product. The original substance is duck liver and duck heart, allowed to ferment for 40 days. Take a couple of drops, diluted 1 to 100. Take a couple of drops, diluted 1 to 100, and do it 200 times, long past the time when there were any molecules left. Supposedly can get rid of the symptoms of flu. Whoops. So here's a 1 to 200 dilution, 1 part and 1 to the 200th. One molecule dissolved in a minimum of, I don't know what it's called, molecules of water. If you actually had a molecule at that dilution, the container would have to be 30 billion times the size of the Earth to reach this dilution. So we have a complete absurdity, but the product sells tens of millions of dollars a year. I'll say a couple words about acupuncture. The theory is fanciful, doesn't affect the course of disease, few practical uses. Practitioners are poorly trained. They almost always make improper diagnoses. They almost always give inappropriate herbal treatment. If they're certified, are they any better? The answer is no. My advice is to never go to an acupuncturist. A couple of nutrition myths are behind the sales. They may say it's difficult or impossible to get what you need from foods. That's simply not true. Oops. They say vitamin and mineral deficiencies are common. That's misleading. Vitamin deficiency is not common among people who eat. Mineral deficiency, some people are short calcium and some people are short iron. Don't have to be too much concerned about the others. They say virtually all diseases are caused by faulty diet. False. Only a small number of diseases are caused by diet. Some of them are very common. Heart disease, stroke, cancer is related, some cancers. But this enables them to try to give you wacky diet ideas to help your diseases. And they may claim that all diseases can be prevented or remedied by nutritional methods. So we have, one idea is if you want to make sure you get enough, you get nutrition insurance where you take a pill on a regular basis. I don't recommend that. I think if you're worried about your diet, you should do a dietary analysis or see somebody who can do one. And if you can't, if you find something's missing, fix your diet. If you want to take a multivitamin, take one a week, buy the cheapest one you find. Don't spend more than $1 a month. On the other hand, you can buy custom formulations sold by lots of companies, and you can spend $30 to $60 a month. It won't do you a bit of good beyond what one a week. Supplements are claimed to prevent lots of things. They prevent almost nothing. Questionnaires are sometimes used to push people in the direction of supplements and make custom formulations. They don't. Genetic testing is now sometimes used as a basis to prescribe supplements. It would be extraordinarily rare for that to be valid, and people who have that kind of a problem should be in the hands of someone who's a specialist in genetics. I say very rare. Therapeutic claims, almost never true. There are almost no supplements that can influence the course of common diseases. Few very rare ones, but again, those people should be treated by subspecialists. Rational use, whoops. If you have an inadequate diet, fix it. Infants and toddlers, maybe supplement for a little bit. By the time they're 2, they should be eating table food, and the diet should be reasonably balanced. You can give supplements a little longer, but not much past that is needed. Strict vegetarians might be short of B12. Some have trouble with calcium. The moral or the short advice, if you're a strict vegetarian, is there are 2 kinds of vegetarians, really, smart and dumb. Smart find out the nutritional implications of strict vegetarianism and take supplements if they need it, make sure that they possibly have their diet analyzed by an expert. Pregnant women may need folic acid. It's recommended as a public health measure. If you eat well, you don't need it, but the doctors recommend it because it's pretty harmless if you take it just during pregnancy. Same thing with calcium and vitamin D. Some people need to supplement. Not a lot. Should be done with medical advice. Iron. Women who menstruate heavily and have very little intake of meat or other iron-rich foods may need to take an iron supplement, but that should be based on a blood test. Some people have trouble absorbing B12 when they're over 50. It's okay to take a B12 supplement if you're over 50. I'm not sure how important that is, but it's something to consider. I'm just going to say a few things about herbs. Misinformation is all over the place. Very few have been adequately studied. Most products don't work. The ones that work may not work as well as medical measures. Quality control is unreliable. Side effects and interactions can be a problem. Most practitioners who want to prescribe them are not adequately trained. Bottom line, I can't imagine taking an herbal product under any condition. So who should you trust? Well, I say, look for the prevailing view, see who agrees. Remember that the media are ad packages, and you should not use, for the most part, you should not use newspapers and magazines as sole sources of advice, or even most advice, that there's very poor quality control on articles that come in the general media. The purpose of the media is to hold your attention so they can sell ads. A few media tend to be reliable, like the New York Times, Wall Street Journal, when they get into health subjects. Learn how to use the internet. I'll tell you a funny story. I've had hundreds of people call me, and thousands of people call me, and some of them start out, I've been researching. That phrase is a very interesting phrase. 100% of the people I've talked to who started out by saying, I've been researching, came out with the wrong answer. 100%. Why? Because researching means you use a search engine to try to find information. And you read as much as you can, and you try to see who sounds the most credible. That almost guarantees that you'll be wrong, because in terms of volume, the number of sites with misinformation is vastly greater. And what's missing is, if you're researching, it means you don't know where to go. It's much better to know where to go and go to reliable sites. We list over 500 on Quackwatch and Internet Health Pilot. I'll give you the URLs later. My advice is, take no advice from anyone who sells dietary supplements, herbs, homeopathic products. Nobody, no druggist, no doctor, no website, no book. Because you cannot, nobody has ever sold these products with completely truthful information. You say, well, I've seen some dietitians, they're selling it. Yeah, what's missing? Complete information about these products. Should first of all tell you that a lot of them don't work. But secondly, they should tell you who doesn't need them. Nobody who sells supplements tells you who doesn't need them. So concealment of that fact means you cannot trust. But there's plenty of places to get advice on supplements from people who don't sell them. Okay, trustworthy sources. For doctors, there's a source called uptodate.com. It's absolutely marvelous, except I think its article on homeopathy isn't very good. After them about that one. They didn't say it doesn't work. They just repeated the theories. It's expensive. It's $30 to get minimal information and $30 a month if you want to continue. But doctors use it, and your doctor may be able to get it for you, or you may, if you have a serious condition, it may be worth buying. The FDA website has excellent information, not the broadest scope. Science-Based Medicine blog is one that I think you'll particularly enjoy. Has in-depth articles, has one every day. They have a team of about 10 relatively young people who are fighting quackery, and they sometimes get long-winded, but they are absolutely deadly with their targets. Quackwatch is my main site. Internet Health Pilot is a site that makes navigation easy. It lists over 500 sites that I've followed that have reliable information. So if you want to search, start out by looking for reliable sites. Now you can use search engines, but only go to reliable sites. The government-based sites, major professional groups, major voluntary organizations tend to be reliable. But if you want to know, if you want to pinpoint it, go to Internet Health Pilot and make that the place where you start searching. Now, what can you do? Keep informed, read lots of articles, subscribe to my free weekly newsletter, Consumer Health Digest, provide accurate information to anyone who wants it, oppose misinformation, and report wrongdoing to regulatory agencies. Now, somebody before I started said, well, how do you persuade somebody? Well, the first thing you have to decide is whether it's cost effective of your time to try. Some people are beyond repair. You can refer people to accurate information and say, read this and then come back to me if you have any questions. If you want to get into somebody who really has a deep-seated belief, you have to do what I call peeling the onion. But if they're not interested in changing their belief, you'll get nowhere. You've got to get to the core, find out why they're taking the product, let's say, what they hope to accomplish. How did they form their belief? What is it based on? Try to take them through a process of evaluation. And the chances are you will fail. And if that happens, don't waste your time. But on the other hand, if you see someone who's being exploited, try to prevent the exploitation. I mean, I tell people, for example, they say, I'm going to a practitioner. My wife's going to a practitioner. I can't change her mind. I say, call up the practitioner and tell them you're going to have them arrested. Tell your wife you're going to do this. Tell your wife or partner, whoever it is, if this is the case, I ask them in advance, if this continues, can your relationship last? And if they say no, I say at some point, say that if you don't stop, we're getting divorced. That's not where you start. That's a desperate move. If you can, in some cases, people are asking other people to pay for it. You can cut off the money if you have the ability. You can discourage people from using GoFundMe sites, which happens occasionally. You may not want to speak out. That's okay. Just protecting yourself is something, and it's a good thing to do. I actually have reached the end of my formal presentation, and now I'm going to stop the sharing, and I'm back. Okay, so
Thank
have
you
time
very
for
much.
questions. Have time.
Andrea has a question, so we'll start with Andrea.
Okay.
Thank you for your presentation. That was very informative. I'd like to hear your comments on the use of marijuana to help certain problems such as pain, depression, and many other ailments. Can you comment on marijuana?
Yeah, this is an area that I don't know a lot about. Quite frankly, it's not an area that I have a tremendous interest in, but I can give you a couple of general ideas. One is marijuana itself and products that are made to pharmaceutical standards are very different things. I would never use marijuana for medicinal purposes. I think you can't measure the risk. On the other hand, using products that contain the active ingredient in marijuana or similar ingredients may have some value against pain. It's not an area I study. You have to be careful that you are advised by somebody who is trustworthy. And I've not really studied how to determine who's trustworthy. But I think if you're sensible about it, you probably can find somebody who is and follow that advice. But I would not experiment with marijuana as a means of relieving pain, even though I suppose it could. I think the potential harm effects are unpredictable. I have personally known people who develop psychoses from smoking marijuana. I mean, long lasting, and that's enough to scare the pants off me. Plus, I don't think smoking is very good for you.
I respectfully disagree with you on some of those points, but thank you for your
Which do you disagree with?
I do believe that it does relieve pain and it helps nausea.
Oh,
chemotherapy, and it definitely helps.
I didn't say it didn't. What I said is, no, I didn't say it didn't. What I said is using marijuana itself is taking an unnecessary risk. You may very well get away with it, but the risk is unnecessary. Using products that are derivatives of where they take the active ingredients is a much safer way to accomplish the same thing. That's all.
Did that answer your question, Andrea?
Thank you for your comments.
Okay.
Jim Peterson?
Yes. I too thought that it was an excellent presentation, and I think it's alerting us to a problem that is society-wide, and therein lies perhaps a degree of explanation as for what's going on, and that is that we are all being conditioned by advertising. Up until about 2003 or 4, it was illegal for drug companies to advertise on television for their prescription drugs. And yet now we see they're everywhere. You can't watch the news or much of anything else without seeing very, very happy people slowly moving through their environment and taking pills. And it doesn't matter what the pill is for, or if it's legitimate or not. It's simply that it conditions people to a belief that life is going to be better and prolonged if they're taking the right pill. And I wonder what evaluation you would give to that proposition.
Oh, it's a very interesting idea. I actually hadn't thought about it before, but you're right. The main thing that I've been concerned about is that, by the way, the advertising of the drugs on TV, if they're prescription drugs, tends to be accurate because the FDA watches them like a hawk. The problem is that there almost always are less expensive alternatives, and it drives people to pester their doctor to get expensive alternatives. And to some extent, it works. I think that, but the problem of prescription drug pricing is an enormous one with all sorts of things that really should be done. I don't have a lot of feeling one way or the other about prescription drug advertising, but I can tell you that the advertising of the other kinds of products is enormous and poorly regulated, and something needs to be done. Now, you mentioned one other thing, and that advertising is driving sales. Now it's not just advertising, it's social media are driving behavior, and it's come up with social media driving anti-vaccination beliefs, conspiratorial beliefs, undermining the government. And so you have people who are, a lot of people who are involved in pushing cancer quackery and anti-vaccine quackery have somehow strengthened people's undermining of government and conspiracies. Tremendous damage to our society, as we saw on January 6th. So the anti-vaccination people are at the forefront of conspiracy theory pushing, because they have all kinds of conspiracies. And so, it's shaping people's belief that our life is full of conspiracies. And so they're more vulnerable to the other conspiracies. And so they storm the White House.
Yes.
Did
Thank you
that
very
answer
much.
your question?
Oh, and
Jim?
by the way, the solution to social media is something called deplatforming. You can't convince people. You can't have an argument through social media because you have to stop the message. It's up to the people who run the media to deplatform. And there's been a tremendous benefit, for example, you can see immediately with the deplatforming of Trump from Facebook and from Twitter. Our society has almost calmed down as a result of blocking Trump's tweets. which were just, monopolizing the news for a year. So I've been trying to persuade the Facebook policy team, and there are other people, and the message is getting across that you've got to cut down. And some of the major quacks and anti-vaccination folks are being deplatformed, and that's necessary. Go ahead.
Jim, did that answer your question?
Yes, it did. Thank you very much.
Thank you, Dr. Barrett. Amy?
Hi, I've got a couple questions. Are you making assumptions here? Well, let me not say that. Let's just say that my opinion is that calling people stupid and dumb is not going to change anybody's opinion. If anything, they're going to
Oh,
stand
I
their
don't
ground.
I never, ever.
You did several times on this call. You used those
No, I didn't
words.
call anybody dumb.
Yes, you said people who do this are dumb. These
I
people
didn't
are
say it.
stupid.
I didn't say it didn't say it to them, and I didn't say it, and I never say it in my articles. Matter of fact, I talk about how intelligent people can go wrong, and that it isn't stupidity that does it. What I'm saying to you is my raw opinion that there are a lot of people out there who really deserve to be called dumb. I would never call them dumb.
How do you know who's on this call?
I haven't called anybody on this call dumb.
Well, you don't know because you've made several
haven't said
statements.
any-
Some of us
I
that might
haven't-
be. Well, I
haven't-
believe definitely in some homeopathic solutions. I've used them. I can't explain why they work, but they work.
Okay,
I've had difficulty sleeping all my life. I told my doctor, she said, try some melatonin.
that's not
I
a
said-
homeopathic product.
Okay, but it's a supplement.
Oh, wait a minute. Let's make a distinction. Homeopathic products don't work.
Okay.
Some supplements can, melatonin can help some people sleep. It's very important to make that distinction. Melatonin has an effect and can help people.
Is it a supplement? It's not a prescription.
Well, is it a supplement? It's not a nutrient. The word supplement has been corrupted by a law that says A, B, C, D, and E are supplements. Herbs are supplements. Hormones are, it's a hormone. Hormones are supplements. They're not, it's not a good way to think. Supplements should be applied to things that are normally in the diet where you take more of them. So melatonin is a hormone
Right.
and it's not a supplement.
What is it then?
It's a hormone.
It's a hormone.
Right.
Okay.
And
Now, some hormones are in prescription form, but this one is not,
correct.
right? And I guess because, is it possible to overdose on melatonin?
Oh, I think so.
Is it danger? I don't know why one is a
Does
prescription, one is
Does
not.
melatonin have any potential for trouble?
Yeah,
Probably. I don't remember.
yeah,
Um,
I've looked it up and I don't take it very often because there can be trouble if you take it all the time.
Okay.
Okay.
Now,
And I had an uncle who was having terrible problems with leg cramps at night.
okay.
And he's a surgeon and he won't listen to some stories. So I said to my aunt came to me, well, I'm the one he wakes up at 3 a.m. and said, oh my God, massage my leg. Okay, because he's got a cramp. So what is it, you said? I said, I read if you put a sliver of soap between the mattress and the mattress pad, it helps. And he hasn't had a leg cramp since she did that. Now, she never told him what she did, but he does not have leg cramps anymore.
Okay.
He hasn't changed his diet. I don't know what it is, but you know what? If it
Okay.
works, it works.
Okay. So far, you haven't said anything that disagrees with anything I said.
Okay.
If you're careful.
Is that a
about-
homeopathic?
No,
No.
no. I don't know how to characterize it, but terminology is very important. When I talk about homeopathic products, I'm talking about products that are given with a particular philosophy behind them, and that are so dilute in most cases that there's nothing in them.
Mhm.
Okay. I was on the Donahue show some years ago and I had a bottle of homeopathic pills. Phil Donahue took the whole bottle at once. Nothing happened. But anyway,
Okay, there's just an article that I listened to called the,
just a minute. What you're describing is called an anecdote. It's a story that may mean something.
Mhm.
But if you want to know whether it actually works or not, you have to do a controlled experiment. So if you want to find out whether it has any effect on leg cramps or whether they coincidentally went away,
Mhm.
you have to secretly stick the soap under the mattress for a month, take it off for a month, put it back, take it off, put it back, take it off without telling. Then you'll find out if it works. And my God, if it works, that'll be nationwide news.
Mhm. Well, there's a group, a couple, they call themselves the People's Pharmacy. Have you heard of them? Terry and Joe Graydon.
Yes.
They have a syndicated column. They're
I
on
know that.
NPR.
I've met Graydon and I've seen his column. What about it?
Well, I was just thinking that he's always looking for people to write in stories about what helped you, or
Yes.
they are actually very instrumental in getting the FDA to start doing some testing of generic manufacturers, because so many people complained to them that they were taking this drug, then they were forced to go to generic and their symptoms are back.
Listen,
So
what's your point about the Graydons?
that's one of the things I learned from them, was that soap thing. And that, if it's a remedy and it works, I'm all
Okay.
for it if it doesn't harm anybody.
Why don't you do does it work on you, did you say? Or
I'm
somebody?
sorry?
Are you using it for yourself?
No, I don't have leg cramps at night. No,
Oh, okay.
but my uncle did. Yeah.
Okay, so you can test out if he wants to find out whether it works. I mean, he may not care, you may not care, but if you want to find out if it works, fine. What the Graydons, I don't approve of what the Graydons do. They have some good advice. They've done some good things. I have seen them give dangerous advice. Their percentage of correctness is far too low for me to recommend. I recommend sources of advice, I want them to be 99 point something percent correct. The Graydons are not that. They encourage all kinds of wild experimentation without telling people that the result may be a coincidence. They don't do that. That's their, I don't know, the word is shtick. I don't know the English translation. I mean, that's how they sell themselves.
Yeah, they try to get people off
Oh,
pharmaceuticals.
We're gonna need to move on. Maybe we can come back to you, Amy, in a little bit. But Jim Young has a question or comment.
Thank you very much, Doctor, for appearing today and sharing with us some very important news, or information which most people are clueless about. This quackery is like a religion. It's faith-based, and like religious faith, it is very defensive. People, you try to reason with them, and they are on the defensive, and they have all kinds of apologetic excuses to justify their bullshit. This country needs laws in truth in advertising, and they should have on every single one of the, they should have a law that if you're going to sell something that's a supplement or just bullshit medicine, the law should require these companies to put in big lettering on the bottle or packaging, there is no evidence this works as represented by quacks. They should just put on there, it's quackery. We need public schools to educate our children about quackery and homeopathy and all these fake remedies. It's a $100 billion industry. And people need to test their beliefs. If they hold a belief that something is real and there is no way to test that to prove that it could be false, they should be discarding that. They shouldn't cling to it. I just wanted to make these comments in support of your presentation, because we've got a country that is rife with blind faith confidence and bullshit, period.
Yeah, I can tell you that I've had enough people who have fixed false beliefs that it's very scary about what is the general level of logic in the US population. And I don't know what the percentage is, but there are a lot of people who have illogical beliefs. And I hope that they don't, I mean, I hope that they don't destroy the country. We had a president who has embraced some illogical beliefs, who had the ability to destroy the world. Thank goodness he didn't. But it's really scary. Quackery is just one little aspect of, or one big aspect of illogical belief systems. But there's no magical way to change the laws, because when we live in a democracy and crooks vote, and people who have beliefs vote, and they may not want to change the laws. Trying to get products labeled the way you say is not going to happen within our lifetime. There's a little bit of a struggle going on to try to get homeopathic products labeled that way. And they've actually been, the Federal Trade Commission has said that you have to now label them, that it's based on historical evidence or something like that. I forget the exact wording, so that they've come within a few yards of what you suggest just for homeopathic products. I don't believe that within the next 30 or 40 years, we'll come anywhere close to what you suggest for health products. There are just too many people who believe in them, too many people making money who make political contributions. You know, there's a dietary supplement group in Congress. There's a multi-level marketing group in Congress. Things are bad. I think all we can hope to do is help a little. Dr. William Jarvis, who is the president of the National Health Council, was asked, do you ever get discouraged? And what he said was, think of garbage. You'll put it out every day or every week, the crooks come away. And but you can't solve the problem of garbage. The trucks keep having to come away. We'll always have garbage. What you want to try to do is have the trucks run smoothly, maybe generate a little less garbage. And so we do what we can. I have an analogy. It was a poem. I shot an arrow into the air. It fell to the ground, I know not where. I shoot arrows every day. Sometimes I shoot them every 10 minutes. I don't know where they land, but I know that occasionally I get feedback from somebody who says, wow, that helped. Or I stopped doing this, or I persuaded so-and-so. So you can do what you can. And right now, probably the best thing you can do is try to, whatever you can, to influence the social media to deplatform. That's where the support is needed from the general public. Deplatforming.
Thank you. Jim, did that answer your, address your comments? Okay.
That did a fine job.
Thank you very much. Vincent?
It's discouraging, but you know.
Vincent? Got to get unmuted, yes. There you are.
Everybody hear me now?
Yes.
All right, okay. I have ashwagandha in my hand. It's an herb. Now, it's in history has been used to stabilize hormones and stuff. Now, there's a
Sorry.
statement
I'm sorry.
that says these.
Your voice is,
Vincent, wait a minute. You're breaking up and we're having trouble hearing you.
tell them to speak very slowly.
All right. This is an herb that has been used for many years. It has a history of work, but now here is something that's written on it. These statements have not been evaluated by the Food and Drug Administration. The product is not intended to diagnose, treat, or cure or prevent any disease. Now, so in answer to Jim, we do have statements, and I don't think we want to go any more than that. People have a responsibility to educate themselves, whether they choose to do so or not. They have a responsibility to do that. Also, in answer to Amy's question, why is one drug over the counter and another one is on a prescription? And from everything I've been in the medical field, and the best thing I can tell you is it has to do with patents. Can they make, because after a certain time, a patent runs out.
No, that's not
unless
true.
they're lucky enough to control substance.
I can
Go ahead,
answer
go
that.
ahead.
I can answer that. That's not true. Why is something prescription and another one would be non-prescription? It has to do with whether or not medical supervision is generally advisable. The prescription drugs are generally considered to be safe when prescribed and may not be as safe when there's no supervision. Over-the-counter drugs are drugs that are considered to be sufficiently safe that people can do them simply by following directions. Those are the criteria. It has nothing to do with how long the drug has been around. In some cases, a drug is available by prescription in high dose and over-the-counter low dose. Now, you read the disclaimer. That disclaimer is required by law on all supplement products. The disclaimer itself is a fake. The reason for the disclaimer is that in the early 1990s, several congressmen pushed through a bill to try to weaken FDA regulation of dietary supplements. And as part of the promotion, they pretended that they were going to make supplement information safer. And they came up with this statement, we call it the Quack Miranda, came up with this statement, which most people don't notice, find to be completely meaningless, because it is meaningless. It doesn't, if they want to be honest, they should say whether it works or not. So they come up with a statement. It means absolutely nothing. It's required by law, and people only take it for the prevention, treatment, or what's the word? Mitigation. The intended use is for preventing, treating, or mitigating disease. That's why people take them. So when the disclaimer is on the label, the manufacturer can say, "Oh, we told you it wasn't for that purpose, but buy it anyway because that's what it does." It's contradictory. It's meaningless, and there is absolutely no evidence that it protects people. It has the opposite effect, if anything. And whether the herb is useful or not is a complicated story.
Well, I'd like to answer to I'd like to say something. The problem with doing a study on herbs is this: it is expensive. Any kind of a study you do is expensive, and so somebody has to make money.
Let me stop you right there. That's industry baloney. There are lots of herbs that are studied all the time.
But herbs,
It's expensive, but there are also scientists.
Vincent, you're breaking up a lot, and we're having a real hard time understanding you.
I'll answer your question though. There's a noise somewhere.
Yeah, could we mute him?
I've already muted him.
Mhm.
I would suggest to Vincent that he enter his question basically into the chat room.
I'm sorry. I'll answer your question. Go ahead. Yeah.
But
Yeah, I can't understand anything you're saying. Vincent, can you enter it in the chat and we'll ask it for you?
hey, I got that. I
Oh,
understand. what
okay.
you said.
All right.
He's giving one of the excuses that's used by herbal promoters that you can't research them because you can't prove them because it's too expensive. There's actually a lot of research on herbs. You can do a lot of research on herbs. You can run inexpensive studies. You can actually run studies that cost nothing, absolutely nothing. Studies don't have to be done double-blind, controlled, randomized. You start out with a case history, a case survey, a case series of 100 patients. And if you do a case series that suggests that it might work, researchers will want to study it. There are thousands of studies done on herbs every year. However, that's not what controls. They have very little influence on marketing. So there are lots of excuses made by supplement manufacturers about how they can't do research. Sorry, folks, it's all baloney.
Oh, thank you, Dr. Barrett. I want to bring up something because, Jim, before you get to go, 5 years ago, I was diagnosed with ovarian cancer. Now, I've not had a recurrence, which is only 10% of the people who are diagnosed with this never have a recurrence. I found myself falling into the trap of thinking, oh, it's because I did yoga every day or other nonsense. When I ask the doctors, they go, we don't know why some people have occurrences and reoccurrences and other people don't. So it's not just, it's very easy to look for magical answers. And I know, like, I'm in a forum with people who have ovarian cancer, and many of them are like, I'm going to take this quack medicine because I know it's going to make me better. And I always encourage them to ask their doctor before they do anything and to continue their regular treatment, even though it's very unpleasant, I have to say, only because I know that when they go to these naturopaths and go to diet supplements and all those things, that they're not going to get, most likely they're not going to get any better. But my concern is how easy it is when you're given a terminal diagnosis, how easy it is to fall into the trap of wanting that magical answer to fix the problem. And unless, like you said, we deplatform these people and prevent them from putting out their propaganda, people are going to continue to fall for it. That's all I wanted to say. So Jim Peterson, it's your
Well, yeah, the important thing if you have, cancer is to realize that cancer treatment has improved tremendously for some cancers. There are some cancers that were 100% fatal a few years ago that are now being cured, particularly melanoma of the skin. Amazing what's happened there. There are some people that adopt what they call a miss no bets, or what I call a miss no bets philosophy. I'm not going to miss anything. I'll continue my real treatment, but I'll take all this other stuff because it might do some help, might do some good. On the other hand, it might do some harm. You don't know. There are cases where certain vitamins interfere with the effect of certain chemotherapy drugs. And there have been people who died as a result of taking ordinary vitamins. They were taking a chemotherapy drug and the vitamins blocked the effect of the chemotherapy. They died as a result. So you're dealing with in kind of no man's land. And by the way, I recommend that people stay away from naturopaths. Their training is abysmal. Okay.
Thank you. Jim Peterson, you had something?
Yes. Again, thank you. When the FDA, the Food and Drug Administration, was first set up, Congress people from various areas prevented the new agency from investigating various kinds of drugs, supplements, practices, and basically quackery in many cases, and largely because the constituencies in their area prevented or would be adversely affected, such that it would perhaps affect the re-election chances of the Congress people involved. But since that time, and this also included things like tobacco and a variety of other common things that people would indulge in that they don't fully understand, and which have been very harmful over many years, in fact. And it seems to me that at some point in time, this becomes a political issue when we ought to be able to tell Congress that they should exercise through the FDA authority on the regulation of anything that you put in your body and any practice which will have some possible adverse effect. Do you think this is something possible in our time?
Okay. The background of FDA regulation is beautifully described in a book called The Medical Messiahs, which is available free of charge, full text on Quackwatch. And that is the book that got me interested in fighting quackery 50 years ago. The second book that will talk about what's happened with dietary supplements is a book called The Vitamin Pushers, which I wrote, which talks about how the FDA got weakened in the mid-1990s. And it's also available free of charge on Quackwatch. And I would recommend anyone interested in these areas to read both books. I think they're very, very thorough coverage of these topics. Do I think it'll improve in our lifetime? No, I think things have gotten progressively worse. I think that the percentage of congressmen who are interested in consumer protection has been falling, and that consumer protection is equated with business, and some congressmen do not want government regulation of business. Right now, I think Congress is somewhat evenly divided, but I don't think dietary supplements are part of what they're concerned about. We have tremendous amount of business fraud. It's not just supplements. I mean, it's been much greater in the financial industry, and the regulation there is still hotly contested. So no, I'm going to be 88. That's not going to happen in my lifetime. Some of you are much younger. It's not going to happen in yours either. No. Should we aim for it? Well, yeah, but there's simply no way to bring it about. I mean, Rick Scott, the governor of Florida, I have an article about him. He walked away from the biggest, a case that I think was the biggest government fraud settlement in the history of the United States. He got away, and I wrote about that. And he was involved in it. He owned a chain of drugstores where they had people telling people to buy herbs. I did what I could to alert the press when he ran for governor, and there were articles about his involvement in health schemes, but it wasn't enough. And he's very anti-regulation. He's cut down what the medical board can do about bad doctors. So we're not going in the right direction in Florida. It's just, pretty much falling off the cliff.
Thank you. We have about 5 minutes left. I don't want to keep you too much past what we agreed to. So Jim and Andrea, if you could keep your comments pretty quick. I see Andrea decided not to ask hers. So Jim, if you could keep your comments quick.
I'd just like to say that I agree with you, Doctor, about the label that is put on these products. It is absolutely worthless. And in fact, I think it does more harm. The label that needs to be on these herbs and supplements and other products needs to state explicitly the efficacy of that product for treating a specific disease if a manufacturer is making claims that it is a remedy for a particular disease.
You don't have to worry about, you don't have to worry about that. If a manufacturer makes specific blatant claims, the FDA can make,
Well, I'm talking about
the
advertising.
FDA can stop that.
Because
They
you
don't
go on the
do that.
internet.
It's almost never.
Yeah, they do. I see it all the time. I go on YouTube and they're telling me about this supplement and it's a cure, but for blah, blah, blah.
It's not on the
all
label.
Bullshit.
Wait a minute, it's not on the
No,
label.
it's not on the label. But what I'm saying is it should be right on the damn label that unless if you're claiming that this has efficacy for a disease, you need to put it on the label. And then if it's fraud, you will be held accountable to the rule of law, because essentially saying, oh, well, we didn't put anything on the label, that's just a get out of jail free card.
Well, my book, The Vitamin Pushers, talks about how the claim you're talking about isn't on the label. And they try to make a distance between the speaker and the label. And if you can't, the speaker doesn't sell the product, he can say anything he wants.
Well, look, if I go to Walmart and I walk in, I want some pills, I want some cough medicine. Well, it says right on there, it's for flu and cough.
We're going to have to cut it.
Okay, I'm cutting it off.
Okay. And
Read the Vitamin Pushers.
Yeah. Andrea, did I lower your hand too soon? I'm sorry. Did you want to?
I have just a short comment.
Okay.
A personal story I want to share with all of you. I had cancer several years ago and I was treated with chemotherapy. And a friend of mine suggested that I buy all these herbs, which I spent $200 on. I asked my doctor about them and he told me that if I take those herbs, it will cancel out all the good that chemotherapy is providing. So I'll end on that note.
Thank you, Andrea. Vincent, I'm going to give you 1 minute, okay? Because we're over our time. Sorry.
Okay, 1 minute. I wrote in a comment to you, Doctor. What is your personal opinion, based on your knowledge, of acupuncturists and chiropractors?
You went over that before.
I'll answer that. I can answer that question. It's like the question, tell me all you know, but do it in a minute. I have an entire website devoted to each subject. I would say shorthand, acupuncturists are almost worthless. Chiropractors are tricky because many of them exploit people. They can do some good if they treat people appropriately. But if you're interested in in-depth look, spend some time reading the chiropractic and acupuncture websites. I have a higher opinion of chiropractors generally than acupuncturists. That is, the good ones can help people, but they shouldn't treat them very long. Acupuncturists, I think there's basically nothing there of practical value. But read why I say it. We have very extensive information on both on the websites.
Thank you so much, Dr. Barrett. Really appreciate all you've done for us today. You've brought up a lot of wonderful topics for us to discuss.